Can you hear me now?
Yeah, I can hear you.
Okay.
I
Somehow
think
my
there was,
headphones got disconnected.
okay, there was some issue, so I think I had to log back in.
I did the same.
Okay.
Okay. Are you ready with the intro?
Yeah, I think people are logging in, but yeah, let me go ahead and
Oh,
share
we
my
got
screen.
we got 3 logged in. There were
Okay.
5.
Okay, let's go. Let me go ahead and share my screen. Okay. Okay, go ahead.
Okay. Well, welcome everyone to our webinar today. Our topic is Always Ready, Build a Culture of Lab Compliance. It is my pleasure to introduce our host. Her name is Deepa Kundaka, and she is the CEO and founder of DKK Safety and Environmental Consultants. She's a certified industrial hygienist by profession and has a master's in safety sciences from Indiana University of Pennsylvania. Deepa is passionate about the management of environmental health and safety programs for her clients. With over 18 years experience in the industry, she has expertise in risk management, industrial hygiene, laboratory safety, biosafety, and sustainability, among others. She has assisted her clients in passing several local and state regulatory inspections, helping them to excel in their EH&S programs. Without further ado, here is Deepa.
Thank you, Andy. With that, we'll start with the agenda for today. And Andy, the slides are progressing, correct?
Yes.
Okay. So for the agenda for today, we have introduction to research laboratories. I thought, since this particular webinar is about lab safety compliance, I might as well give some introduction to research laboratories, lab safety, lab and site layout, laboratory hazards, elements of laboratory safety inspection readiness, and then some tips and tricks to lab management. So introduction to research laboratories. Normally, we have bioanalytical laboratories analyzing biomarkers, testing their kind of drugs to make sure the biomarkers are performing the way they want them to perform, whether it's oncology treatment or metabolic disorder. They develop assays to test biomarkers. So that is pretty much what goes on in bioanalytical laboratories. And the therapeutic research and development work for treating could vary anywhere from cancer, metabolic disorders, immune disease, and respiratory disorder. So let's see how the lab layout looks like. These days, the trend is they have an open lab where a lot of scientists can typically share like a centrifuge or a fume hood, HPLC instruments and things like that, fume and biosafety cabinets. And then for certain specific jobs like what is that, liquid chromatography, mass spectroscopy, they might have a separate room where they need it for a specific setup, like confocal microscope room needs to be dark, so that could be in a dedicated room. But for the most part, like you see in the picture here, you can see open lab setup. And depending on what you guys are doing in the lab, there could be glove box isolators if you are handling powdery stuff. And then without saying there will be hazardous waste containers, bio-waste containers, because when you're processing stuff, there will be waste that will be generated, and then flammable cabinets for storing flammables. And the site layout, normally there'll be a centralized storage area for hazardous material, key raw ingredients and chemicals, solvents, reagents are stored. Hazardous waste, there'll be a dedicated room for hazardous waste. and then compressed gas cylinders, and then a nitrogen tank or a specific blend of gases depending on what happens in the lab. When you're in a lab, there are hazards all over the place. There could be flammables, corrosives, oxidizers. Hydrogen peroxide is an oxidizer. It's a great cleaning agent, but it is an oxidizer. You have toxics like potassium cyanide or sodium azide, carcinogens. So these placards, you see them often in the SDSs. They are definitely there, and the hazards are all over the place. So and in today's webinar, I wanted to touch up on fundamentals first, because we might have participants who are entry level to mid level to seasoned veterans in the lab. So I'm kind of starting out with some basic information. It could be a repeat for those of you seasoned veterans, but trust me, we need to kind of touch upon that for somebody who is new to the lab. So there is primary label, which is a basic hazard communication standard by law. The manufacturer of a container is supposed to have a chemical name, pictogram, vendor information, signal word, like, this is harmful, or this is a target organ, type of a target, it's a cytotoxin. So they need to put that information down. Precautionary statements, hazard statements. So you see that acetonitrile bottle there in the picture. It has all kinds of information the manufacturer by law is supposed to put. Now, if you're taking that compound and pouring it into a beaker or a smaller container, immediately you need to have at least a chemical name or hazard warning. Oftentimes during the county inspections, this is something where we see people kind of think, I'll get to labeling this later, and that later never comes up. And then there you go. You now have a hazard for your own employees, and then you have a compliance issue with the county inspector. So make sure there are pre-printed labels if it is acetonitrile, methanol, or some of the commonly used agents. Then make sure you have the labeling, the right chemical name and hazard warning. With that, we go to our first poll. Acids and bases shall be stored together, true or false? So I'll have Andy launch the poll.
Okay, so I just launched a poll. Give everybody a minute to vote. Okay. Well, we got 67% of the vote in. It doesn't look like it's changing anymore. So I'm going to go ahead and publish the result. Oh, now we got up to 83%.
Okay.
All right, so here is the result.
That's good. Most of you know what you guys are doing. So it is, yeah, they shouldn't be stored together because they are definitely incompatible as much as possible. I know there could be some space constraint somewhere sometimes, but as much as possible, even with the glass bottles, that's a main concern, because if something were to break in the event of an earthquake or, the general handling, if your acids and bases mix together, then we have reaction going on, and sometimes it can be an uncontrolled type of reaction. So we want to avoid that as much as possible. So we'll go ahead back to the webinar screen. Chemical segregation, again, properly segregate chemicals, acids from bases, flammables from toxics. This is one of our inspectors had told us flammables. Why do we store flammables away from toxics? Is if flammables catch fire with toxics, then the toxic fumes will spread throughout the lab. So try to segregate flammables from toxics. Also, those are one of the segregations, other segregations we can think about. Now, safe methods for handling and storage of hazardous material. Make sure you have flammables stored back in the flammable cabinet. The commonly used reagent solvents I can think of is methanol, acetonitrile. People, use them in the fume hood, and then sometimes they leave them in the fume hood even without secondary containment. So maintain separate dedicated cabinets for acids and bases, and have a chemical storage location with keycard access to store routinely used chemicals and reagents. Now, sometimes you might have flammables that need refrigeration. Make sure you buy one of those commercially available dedicated flammable storage refrigerator and not just regular refrigerator, because there could be sparks, in our regular refrigerator. But if you buy the one that is dedicated for flammable storage, then all the controls come with it. So make sure you invest in those flammable storage refrigerators. Chemical hazards, we will go into engineering controls and hierarchy of controls, but before that, I wanted to touch up on chemical hazard, route of exposure, inhalation, vapors, fumes, dust, like if depending on what our workforce is handling, scientists, lab services, there could be vapors from a chemical, there could be fumes, there could be dust if they are handling pharmaceutical ingredients, absorption, contact. That's why it's so important for employees to wear their PPE, contact through skin, splash on skin, a lab coat, safety glasses, and gloves. Those are bare minimum for in terms of PPE. Injection hazards could be needle sticks if you're using needles. Sharps, we have them in the lab. We have glass containers, not just needle sticks. And then ingestion, make sure when they leave the lab, they have means to wash their hands and enforce it, because, we don't want them accidentally ingesting any of those harmful components into their bodies. So splash to face could be another ingestion hazard. So that brings to our hazard control strategy in research labs. So this is the hierarchy of control. Elimination, by all means, if you can physically remove the hazard, do so, because that really helps to eliminate the hazard. And then substitution, instead of using, acetonitrile, for example, Millipore Sigma has come up with a more, a much reduced harmful chemical as opposed to using acetonitrile. You can use that as a substitution. Engineering controls are one of the strategies too, to isolate people from the hazard, like fume hoods, biosafety cabinets, glove box, and things like that. And despite all these layers, administrative controls go a long way. You need to have a signage that says, this lab is such and such, has such and such hazard, to kind of warn people. And then PPE to protect the worker with personal protective equipment. So that brings to us to the next poll question: what form of control strategy does fume hood fall into? Over to Andy.
Okay, so here comes the poll. I'm going to start it right now. Give everybody a minute to chime in. So yes. So very quickly we get up to 67%. Let's see if we get any more. All right, we're up to 83%. I think I can go ahead and publish the results. Here it comes.
Okay, so yeah, engineering control. We had really have some seasoned veterans in the lab there in the crowd. Yes, fume hood is an engineering control. It has ducting. It has all kinds of ventilation engineering going on there. It's not just controlling, the vapors at the source. There's more to fume hood. So with that, I will go back to my slide deck. So engineering controls, make use of engineering controls such as fume hood to reduce exposure to harmful vapors. Definitely enforce this if people are using solvents such as methanol, acetonitrile, isopropyl alcohol, to name a few. And then check the fume hood certification date. Sometimes you might have 20 fume hoods in the lab, and then of course, we outsource this to an outside company to do the certification. Oftentimes, one or two is missed. So we have made it a practice or into a cadence for our scientists to check the fume hood certification date when they work at the fume hood. And there's also a nice OSHA article that supports that work at least 10 centimeter or 4 inches inside of a fume hood for better protection. That way the vapors are captured at the source and your employees are protected well. There could be some solvent squeeze bottles which are routinely used and shall be stored inside the fume hood, like acetone. 70% isopropyl alcohol is the other one. I mean, it will be very hard for us to keep every single of those back into the flammable cabinet. And if you're using it routinely and they are closed, I mean, the squeeze bottles and the spray bottles are, kind of considered partially open, but we have seen that, it is considered acceptable. Biosafety cabinets are another form of engineering control. If your scientists are working with cells, biological materials, then biosafety cabinet is a primary engineering control used to protect personnel against biohazardous or infectious agents and to help maintain quality control of the material being worked with as it filters both inflow and the exhaust air. So that brings us to the next poll question. What type of biosafety levels are found commonly in research and development laboratories? Over to Andy for the poll.
Okay. Here comes the poll. For everybody a moment.
Interesting. Some people voted for 3 and 4.
Let's see, we're up to 57%. Or get any more? Okay, it doesn't look like it's changing, so I'm going to go ahead and publish the result.
Okay. Okay. Yeah, from our experience and what we have seen in the industry, biosafety level 1 and 2 are most commonly used in the research and development laboratories, unless you're working with something really hazardous like Ebola and, some higher hazard, higher risk categories. It could be 3 and 4 for those people, but a majority of the People are at level 1 and 2 for the most part. And level 1 is actually benchtop work, where the microorganism is not considered harmful to either the humans or to the environment. And then the level up is the level 2, where if you're working on with lentivirus or E. coli, I've seen people jump to level 2. So okay, thank you for answering the poll. Let's go back to the PowerPoint. Um, yeah, again, engineering controls to safeguard employees from asphyxiation hazards. So if you have liquid nitrogen in use or carbon dioxide, there are these dual monitors that come that check for both oxygen levels and carbon dioxide. I would highly recommend to install those in the areas where for some reason, if there is a huge liquid nitrogen leak, then it can lead to asphyxiation hazard. Now, carbon dioxide is fed into the incubators, and from a risk assessment perspective, it has proven to be a lesser hazard. But again, you cannot smell carbon dioxide. So I would say definitely look into a meter for even for the carbon dioxide monitor. So administrative controls. So we are stepping from engineering controls to administrative controls. Again, warning signs, lab door signs, standard operating procedures. These are all important, despite having high level engineering control. Administrative controls are even important, because you still have to train your staff. You still have to have standard operating procedures, lab door signs, and warning signs. And these keep changing depending on your research, things that are happening in the lab. So educate your crowd. You cannot over communicate on this aspect. And spill containment, keep kits well stocked. Absorbent pads, socks, waste disposal bag. I mean, the key is to prepare yourself. I mean, it's a wishful thinking that the spills will never happen, but unfortunately, sometimes they do. Place them in your chemistry lab or biology lab for emergency preparedness. If you don't have to ever use them, again, it's like insurance. No problem. You replace them if at the end of the expiration date on the spill kits, but keep them well stocked. That will help. Okay. And then personal protective equipment. Again, with all the engineering controls, administrative controls, although this is a last resort, enforce the use of a lab coat, safety glasses, closed-toed shoes. I mean, oftentimes the scientists will say, oh, I'm just going to take a look at one thing in the lab. And then they'll kind of say, I'm not going to wear lab coat for that one thing. But that one thing will lead to the other. And that's why I'm a big proponent of, we have demarcation at some of our client sites that says PPE required beyond this point in the laboratory. So no questions asked, everybody follows the rule. Whether you're going for a minute or you go there in the intention of going for a minute, then you're kind of there for hours because you're troubleshooting something. And we want to protect our employees first and foremost. Safe methods for handling and storage of hazardous material. Ensure, again, flammables are stored back in the flammable cabinet. I cannot emphasize this enough, because oftentimes the flammables are, left on benchtop, left without secondary containment. So make that a habit for your scientists, your employees, to put it back in the flammable storage cabinet. And use secondary containment, such as rubber baskets, while transporting flammables, because employees are going from one location to the other. They have to get to the doorknob and whatnot. So make use of a cart with a secondary containment or rubber baskets. And if you're storing non-flammables on countertops, store them inside of a secondary containment, because it will, if there is, for some reason, there is spill, it's contained. So it's always a better arrangement. Evacuation procedures. Exercise your evacuation drill. There could be an emergency situation where people have to leave the lab. It's, during pandemic, we couldn't really exercise the evacuation drill, but now make sure your employees know how to activate the internal facility alarms, communication systems to notify, facility personnel. Define your assembly area during the evacuation, run the evacuation drill at least annually, and document the paperwork for record keeping purposes. You can use June is National Safety Month for, running your evacuation drill, or in September, there is, what is that, emergency preparedness month coming up. You can set aside that month for preparing your drill, because it definitely takes a whole company. If you're a 4-story building, you have floor wardens that have to be up to speed with all the changes that have happened. You might want to look at your evacuation supply cabinet and update those. Very important. Emergency equipment, perform monthly inspections for portable fire extinguishers, emergency safety shower and eye wash stations. It's very, very important that you check the emergency safety shower and eye wash stations monthly. As per Cal OSHA, this is a monthly requirement. And if you're following ANSI standard and doing it weekly, kudos to you guys. Maintain well-stocked first aid stations. You never know when we need them. Chemical protective clothing, not just for regular use, but if there is a spill, you might want to keep a stock of Tyvek suits, lab coats, safety glasses, and gloves. Also, make sure your facilities does proper preventative maintenance on fixed fire systems, sprinklers, fire hoses. Safety equipment location. Have a site map with emergency safety equipment marked on it. Also indicate on site map the locations of hazardous material, hazardous waste above the threshold of 55 gallons for liquid, 500 pounds for solids, and 200 cubic feet for gases at normal temperature and pressure. With that, we go to our next poll question. How often should we inspect the emergency showers and eye wash stations as per California OSHA regulations? So I'll have Andy run the poll for that.
Okay, the poll is up. Got 70% in so far. See if we get any more choices. Okay, I don't see it changing anymore, so I'm going to go ahead and publish the result. And here are the results.
Hey, very interesting. So as per California OSHA regulation, it is a monthly requirement to do the emergency shower and eye wash station inspections. And if you guys are doing weekly here, some of you voted weekly. That is excellent. Perhaps it's like, it's good to go to the gym every day, but do we end up going every day? No. So, and if you guys are doing this great, quarterly, no, you have to do it monthly, because there could be sediments there. You make sure the water flow is clear. So when people are using it, in the event of a chemical splash, the water is nice and clear. And there's also a concern about Legionella bacteria growth if we don't flush the water on a monthly basis. So for that reason, there is another reason that we recommend doing it monthly. And it's also the law as per California OSHA regulation. Thank you for the poll. Let me go back here. And then chemical inventory. So this is often, the chemicals keep coming in to your building, and then, this is something that constantly needs to be updated. Yes, it is a pain in the neck, but you have to maintain current chemical inventory of all the chemicals stored and actively used on site. Safety data sheet database can be maintained either electronically or in the hard copy format. Calosha is fine with electronic maintenance of safety data sheets, whether it's a hard disk on your on your company drive, or sophisticated systems like there are softwares that store safety data sheets. So yeah, that's fine. Now, as per the law, all the SDSs are becoming more and more sophisticated with 16 section format, and it's the law, so they are supposed to have those detailed information about everything from chemical composition to engineering controls recommended, first aid measures, and even environmental information. This is just an example of chemical inventory database. You can have CAS number, chemical name, permanent storage location, vendor, product number. We say product number because the same HPLC grade of acetonitrile might have two different product numbers. So you might as well capture that while you're at it, amount and the SDS link. Some of our clients use as simple as a MS Teams folder to maintain this, and they have a Teams channel where people have access, and they empower people to, if there is a addition of chemical in their lab, they ask them to upload, add a new chemical a chemical into their database. Safety data sheets, again, they provide comprehensive information of a substance. Oftentimes, when we have a incident in the lab where there is a splash on an employee, or somebody gets injured with a chemical, that's the first thing we want to see. What are the precautions that are needed, first aid measures and things like that. So make sure you have them handy. Exit and egress, keep hallways and egress path always clear. You always have some equipment, a huge equipment that lands up in your corridor on a Monday. And if you don't enforce it, people are like, okay, oh, my vendor is coming 2 weeks from now to install it. Okay, at least you have that answer to give to the inspector if they ask, how long is this equipment going to stay? And some inspectors are like, no, 2 weeks is not acceptable. We will give you like till tomorrow to clear it. So, have your plan together, and just don't leave huge piece of equipment as an obstacle in the hallway, because it's going to be an enforcement, a compliance issue. Electrical safety, definitely maintain 3 feet clearance in front of the electrical panel, because if there are issues that happen, we want to make sure our facilities folks have good access to the good amount of access to the electrical panel. Compressed gas cylinders. They have to be secured at 1/3 and 2/3 height. Use cylinder dolly for transportation. So you have to invest in all these bare minimum things, because make sure you have a cylinder dolly and people know about using them when transporting from from the storage area to the lab that they are using them. And then secure it at 1/3 and 2/3 height, because the regulation only says secure it. They don't say 1/3 and 2/3 height, but we live in earthquake zone, so it's better to kind of secure it in 2 areas, just so that it's secure and nothing is going to happen in the event of an emergency. In the event of chemical exposure, emergency procedure may include flush with water for 15 ice. If it's a splash into the ice, absolutely flush with water for 15 minutes. Remove contaminated clothing and wash affected areas with soap and water. Inhalation, if there is an inhalation hazard, we had this happen at one of our client site. Moving that employee to the fresh air helped to as a first aid before we could transport that employee to the to the urgent care. So these are the things the SDS will tell you. And inhalation hazard, by all means move the individual to fresh air, like outside. Swallowing, get immediate emergency medical assistance, and always read the label and SDS for chemical you work with. Send a copy of the SDS with the employee, so that will help the caregiver at the other end. Hazardous waste management. Keep hazardous waste stream list ready. Maintain active waste profile for the current hazardous waste. And keep your hazardous waste manifest record for 3 years, because that is something the inspectors will ask you. Hazardous waste containers must be closed when not being used, rigid and leak-proof. Store them in rigid and leak-proof container in secondary containment and labeled with hazardous waste label. This is often kind of missed. Like sometimes people think, oh, I'll get to putting this hazardous waste label later, and that later never comes. And we don't want to be in that situation. We don't know what is in that container. So hazardous waste storage central location must be inspected weekly, and paperwork has to be kept ready. What does a hazardous waste label have? Normally, generator's name and address, your company name and address, EPA ID or CAL EPA ID, hazardous waste, contents, hazardous properties, physical state, start date, and the fill date. So, and we all know about the California empty rule. If it is a chemical container less than 5 gallons, if it contains you have used up all the components of that container, and there's no steady stream of liquid coming out of that liquid container, like for example a bottle of methanol, you can deface the container label, and you can throw it in the recycling bin. Same holds for the solid. As long as it's reasonably empty, you don't see any chunks or something that is still sitting in the container, then deface the container by all means, and you can recycle them. Only if it is extremely hazardous chemical like sodium azide or potassium cyanide, then you are not allowed to throw that in a regular recycling bin, even if you defaced the container label. Bio-waste container management. Ensure bio-waste containers are labeled not just on the front, but on all sides and on the top. Have a red bag liner meeting ASTM standard. Some of the people put 2 liners, which is a good practice. So that's a tip I'm giving you guys. It works great. Closed when not in use. Again, this is frequently seen violation where the biosafety container, the biohazardous container is left open. We don't want to see that. And training records. Very often, the inspectors will ask for training records. Have training curriculum for lab personnel in hazard communication, hazardous waste management, bloodborne pathogen programs, and medical waste management program. Maintain training record keeping, whether it is your online learning management system or just a Excel sheet in your company hard disk. That's fine. You just have to make sure you can pull those records when the inspector asks for it. So just in a summary, I wanted to touch upon hazard communication program, which is often, the main standard when it comes to lab safety compliance. You guys need to have a written program for hazard communication, have material safety data sheet handy, and have proper chemical labeling and training. And again, chemicals can enter body through absorption, inhalation, injection, and ingestion, and at excessive levels have severe toxic effects. Hazard control strategies include elimination or substitution, engineering and administrative controls, and PPE. Safety data sheets must be readily accessible to all employees in their work area or work site. Chemical labels must include the identity of the chemical, specific health hazards, including target organs. So with that, I finished the first part of the lab safety compliance. Now we'll move into the tips and tricks for lab uh, s- um, safe laboratory management, which this is a tool that I'll give you guys, which you can, think of implementing or implement it. One other popular one is the fume hood challenge, a competition among scientists and lab personnel to maintain fume hood organized and tidy. So you can pick a month where you give them the fume hood challenge will start on this date and will end on this date. Maybe give them 3 or 4 weeks to complete the challenge. And it has a checklist that goes over like, does your fume hood have a active certification date? Does it have are you storing things excessively? Then, for removing containers, they get points. So there is a Excel sheet that we maintain to give them points. And first of all, you have to choose a champion who can, or nominate a champion for this fume hood challenge. Maintaining sash at the recommended height to reduce exposure to solvents and chemicals. Um, the challenge really helps them to become aware of annual certification dates, putting solvents and glassware away after use to reduce clutter. So not just the solvent, sometimes it's the glassware that sits there. Raising instrument to improve airflow. So you don't want to block the airflow. If you have an instrument that is blocking the vents at the back, you might want to have a nice, kind of a razor to raise the instrument. International Freezer Challenge. This is something that My Green Labs had started a couple of years ago, and it is a global challenge. It's free, a competition among scientists to maintain current inventory of biological samples, reagents, virus, among others in the freezers. So the biggest advantage to this is you can motivate the scientists to keep updated inventory of biological samples and reagents. But samples that are no longer needed, you have discontinued certain study and now you no longer need those samples. So this is your chance to empty it and maybe make room for your new samples. Explore options to maintain digital inventory of samples. There are a lot of software that is available for digitizing your inventory of samples. And keep an eye on freezer preventive maintenance elements to make sure your freezer stays healthy and reduce frost buildup and prevent injuries associated with handling ultra cold samples. Now, the biosafety cabinet challenge is very similar to the fume hood challenge that I mentioned earlier. This is if you are predominantly users of biosafety cabinets, then go for biosafety cabinet challenge because, again, nominate a champion. The advantages are it makes scientists aware of annual certification. It makes sure they're aware of adequate airflow, HEPA filter performance, and maintain BSCs clean after use helps to reduce lab-acquired infection and then cross-contamination. Last but not the least, employee engagement. So how do you engage your employees in, safety practices? You might have some safety observation software in place where you submit an observation regarding an unsafe act or an unsafe condition. The wire is frayed for such and such equipment that is plugged in. It is a electrical hazard, fire hazard. They not only put the ticket for unsafe condition, but they also then submit a ticket to facilities to replace the wire and have it replaced and make it a safe situation. So Safety Champions program, you can have Safety Star of the Month. There could be a peer-to-peer recognition. You can have monthly safety themes, like June is National Safety Month, and that was one of the reasons I wanted to do this webinar this month, so I could touch up on that and then give back to the community. Annual Safety Excellence Awards. As a corporation, you might have annual Safety Excellence Awards. These are great employee engagement tools, so make use of it, and this will go a long way. it motivates people. Internal lab inspection programs. You might have your own internal lab inspection program um, every month or every other month. It promotes a culture of safety and early hazard detection. When you give employees a checklist to go through a bunch of things that are related to safety, it helps with hazard detection, improves compliance, empowers employees. Now employees don't have to do guesswork. They know, okay, the safety shower needs to be inspected monthly. This is not inspected, so they can put a ticket. Enhances documentation, and you can show this to your, if you have any kind of outside agency inspection, you can say we have our monthly inspection program that goes on, and it fosters continuous improvement. So that is a great thing if you guys are doing this already for your company. And then lastly, the references. I have both California OSHA regulations, occupational exposure to hazardous chemicals in laboratories, and then Section 5194 on hazard communication. 51991 is often referred as chemical hygiene plan, but according to the standard, it's occupational exposure to hazardous chemicals in laboratories if you're specifically looking for laboratory compliance. So with that, yeah, contact us if you have any questions. My email is deepa@dkksafety.com. And yeah, if you need any assistance with compliance, DKK Safety and Environmental will be you can approach us. With that, we'll see if we have any, now is the time for any Q&A. And I really appreciate you guys tuning into this webinar. You could be at different places right now, maybe going for a walk or doing something, but you chose to log into this webinar. So DKK Safety really appreciates that. If there are any questions, we can take questions now. Very quiet crowd today. No questions?
I'm not seeing any come in through the chat
Okay.
or Q&A.
Okay. If there are no questions, I'll give you kind of 10 minutes back. We don't see any Q&A coming in, or maybe we'll give maybe one more minute. There's a Q&A button there where you can put your questions. Okay. Again, thank you for tuning in to our webinar today. This means a lot, and we will have more webinars coming in the next month or so, and we will look forward to seeing you. Thank you.
Thank you, everyone.
Thanks, Andy.
You're welcome. Thank you, Deepa.
Yeah, bye.
Bye.